Good afternoon. What we're going to be doing today, we're going to be performing an eye irrigation. And the purpose of an eye irrigation is to remove foreign particles of a patient's eye. And one of the most important things that we need to make sure is that before seeing the patient, we have to wash our hands at all times. You guys notice that there's not a sink in this exam room, but before we actually stepped into the exam room, I did wash my hands. And every exam room should also have a sanitizer pump in the room, just in case if there's not a sink in the exam room. The equipment and supplies that we have set today is the sterile irrigation solution. All this is normal saline, which is 0.9% of sodium chloride, and it does state here it's for irrigation. We also need to make sure that the normal saline is up to date, so we need to check our expiration date, which is July of 2013. We need a sterile container that's going to be holding the solution, which today we're going to be using the standard basin. This basin is actually used for ear irrigation and also used for the eye irrigation. Another important thing, part of the personal protective equipment, we have our exam gloves, and these are non-powdered, and the purpose of the non-powdered is just because we're actually going to be dealing with the eye. We don't want any type of powder hitting the patient or contaminating the patient and causing more irritation. We also need the 4x4 sterile gauze. We actually have 4 of them in here. And another important thing is the waste container that we actually need in every exam room. This is a non-bowel hazard container, but it's okay. We're not dealing with bowel hazard substances today, so we can actually dispose of it in the regular container. Another important part of the procedure is the medical chart. We need to make sure that we have a medical chart with you at all times, just to confirm that you're actually doing the right procedure on the right patient. All right, what we're going to be doing next, we are going to be putting on our exam gloves at all times. We've already greeted our patient. We've already confirmed that we have the correct patient that we're going to be doing the procedure. The patient's well and calmed at this moment because I've already explained the procedure. And if you guys notice, we already have a towel. This is just in case if we have any normal saline, we don't want to get the patient completely wet. What we're going to do, again, we have the sterile solution. We're going to crack open the vial and dispose of that. We also have the sterile syringe that we're going to be using. There's different types of instruments that you can actually irrigate the eye. Today we're going to be using the actual syringe. We're going to be drawing up at least 20 mils of normal saline today. We need to make sure we break the seal. And I'm going to get the basin close to the patient over here so the solution can fall into the basin and not onto the patient itself. Okay, what we're going to be doing, we're going to be drawing up, again, this is a sterile syringe without the needle. We're going to draw up the solution, 15 to 20 mils. And all this type of solution is going to be per the doctor's orders. The doctor's orders you will find in the medical chart. It will have the amount that you'll need, and make sure you have the authorization from the physician at the time. I will use a sterile gauze as well. And we're going to ask our patient to lean just a little bit to the right side, because we want to have the patient to lean to the affected area, which is our right eye. So we're going to start with the right eye, lean to the right just a bit. And the patient's a little bit high, so I'm going to remove one of these pillows and bring her back down. That's a little bit better. The patient's still comfortable. So what we're going to do is lean forward or lean to the right just a bit, and just gently. We can also ask our patient, if you don't mind, put a little bit of pressure right here in this basin with your right hand, just like that. So the water can actually go into the basin and not to the side of the patient. What we're going to be doing, we're going to be irrigating the right eye. We're going to be removing some particles from there. We're going to start in the inner canthus of the eye, and that's the actual center or the middle edge of the eye. And what we're going to do is we're going to work our way out to the outer canthus. So we're going to kind of help the patient open up the eye just like this, and we'll gently. If you guys notice, the patient is squinting just a bit, and that's just normal, and that's through the autonomic nervous system telling that the eye is about to be affected. So we're going to gently remove, irrigate just a bit. Okay, and what I'm actually going to do is get this sterile gauze just wet just a bit, and from the inner canthus, work your way out. Okay, you okay, ma'am?
Yes.
All right, we're going to try this once again. Help the patient open up the eye and irrigate the eye just a bit. You could put a little bit of pressure, removing the foreign object. Okay, put this wet just a bit. Start from the inner canthus, work your way out. I'm going to collect a little bit of normal saline using these sterile gauze. We're going to clean the patient up just a bit. Once again, start from the inner and work your way out. Dispose of this gauze using one more sterile gauze. We're going to repeat. Start in the center, work your way out, and dispose of that. And we're going to be using one dry pad, and what we're going to be doing is just dabbing the eye. Depending on the injury of the eye, we're going to be possibly putting an eye patch if the doctor has ordered that. But today, we're just going to be irrigating the eye, and I think we're going to be completed now. Get a few tissues for the patient and remove the wet towel and give the tissues to the patient so they can clean the right side of the face and neck if the patient needs to. Before dismissing the patient, make sure also that you guys will give the follow-up instructions to the patient, and possibly the patient will be returning back to the medical clinic within the 2 weeks for a follow-up appointment. We are going to be disposing these items. Once again, once this normal saline, this has been sterile, we have to dispose of the whole container. So we'll put it aside for right now. Dispose of the whole items here. You can always put the lid back on this and dispose in the regular trash can. Our basin that we actually were using, we're going to dispose of the sterile gauze that we've used, dispose of them in the regular trash can. and we're going to sanitize this, and we're going to be disposing of the solution that's in there as well. Our gloves will be removed, as always. Proper technique, removing your gloves and disposing those in the regular trash as well.
Okay.
Okay, so once we have removed all that, we've cleaned the items. Before leaving, make sure you guys complete with sanitizing your hands. Once you leave the exam room, make sure you follow up by using the aseptic hand washing. Thank you for watching the proper way for the eye irrigation. Thank you.